Good day, my dear students. I am starting, or rather plunging into a venture, which I hope we shall sail through. Angels fear to tread where fools dare to leap. Whether I am an angel or a fool, time will say. What is bothering all of us is not the routine classes or the matter that we study, but rather NEET or next. This we shall try to unravel in the next few slides. Again, a beautiful picture thanks to NET. And the message is NEET or next. Always you find that there are different kinds of questions. I always used to say that the greatest fool can ask more questions than the wisest man can answer. If we were to analyze the questions as such, they could be direct questions. How many kidneys are there in the body? And we say 2. It is a simple recall type of a question. This was what that was there initially. But then as the competition rose and the competitors increased in number, there had to be different levels and different patterns of questions. Sometimes there can be sequential, one following the other, in which case we will have to be logical in arriving at an answer. Value-based, whether it is an X-ray or a laboratory finding or any other biopsy, we will have to interpret. This goes to a higher level of thinking. Case-based, similarly, your application as a clinician, how do you analyze, correlate all the findings and come to a conclusion so that you are able to treat and save the patient. Problem-based, this is something that is more of a problem for us because it is less understood and over-projected. We shall see the pitfalls in all these in the days to come. In which case, again, we will have to analyze and solve problem-based questions. Also, interdepartmental. There is a lot of confrontation that is going on. Which subject is more important, etc. But now we find that the questions cut across several disciplines and departments, in which case we will have to integrate the findings. This is called the Miller's Pyramid, an age-old school of thought about how education should be, or rather medical education should be. There were different levels of teaching. And for example, initially the student is supposed to be just knowing, but later on he knows how things are happening. He performs under guidance, shows, and finally as an individual he applies all that he has learned and he does it. This is the age-old Miller's Pyramid. And here they have said a fast recall is an MCQ. Paradoxically and very unfortunate that this is not true nowadays. In the highly competitive examinations, we find that it cannot be the lowermost. In fact, you people are better versed and better knowledgeable than me in knowing the problems of it. There has to be an interpretation, application, demonstration, and finally a performance. But this is not applicable as far as the NEET or the next is concerned. Now, I would like you people to kindly concentrate on the picture to my right. A lot of things are being displayed in it. The competition, the anxiety, the pressure to perform, etc. And this is what the competitive exam today stands at. As a teacher with decades of experience, I know the different types of examinations that the students cross. One is called the formative. This is nothing but your routine internal assessment test or a day-to-day assessment so that you are made or molded into a better student. Summative is at the end of the semester or the year, they assess your clinical and theoretical knowledge, and finally they give you a mark. Clinical or practical per se is trying to apply what you have already learned. This is what we do in our practicals as well as in the clinical examination. We call it a psychomotor skill. But there is a last one, which I mentioned earlier, competitive exam, which is beyond all this, and it does not find a place in the Miller's pyramid. But unfortunately or fortunately, this is exactly what we are staring at. This is a cartoon that I've used a number of times in any of the classes in medical education. And look at this, racing against time, sweating against anything, and trying to discover answers which are not there. So these are the various parameters by which the student is being assessed or being made ready. Formative, summative, etc. we had seen. The university exam, wherein you are given a pass and a degree. Competitive exam, just as the NEET or the next. Clinical postings, where our acumen is being tested. Apart from this, you find that the attendance of the student to the daily classes is required. He has to undergo the coaching in the competitive centers, as well as cannot compromise with the basic fundamentals as a doctor. You cannot just be going to the coaching centers and avoiding the day-to-day classes or the clinical practice. So this conveys a lot of meaning to me. The student now, he is not only to face the competitive exams such as the NEET or next, but also perform his day-to-day work and come out as a skilled medical personnel. So in this series of R.A.T.S, what am I going to say? The NEET and next. We are going to something different, a different level. And in this, there are different batches of students who belong to different academic years. The first year, second MBBS, third MBBS, final MBBS, and even the CRRIs. What I have in mind is something different for each of the batches, though the classes will be common. For the first MBBS, it is supposed to just sensitize the student and teach him how to balance. The second MBBS, he has to read thoroughly because pathology is his university subject. And also he has to balance between the routine as well as the competitive exams. In the third MBBS, he has to review his first and second MBBS portions as well as balance and keep abreast of the changing times. The final MBBS, again he has to revise, go through all these portions as well as devise his own strategy. Also, finally, this is the most precarious position. He has to balance between, he has to pass his clinical examination, get a good mark on the competitive exam, and finally, he has to gain some post somewhere. As a CRRI, it will be too late for us and you will have to devise your own strategy, be it your reading day and night or through any competitive centers whatsoever. So this should be your mode of preparation. And the target for the student, please do understand, it is a university exam in each year as well as the competitive exam that he has to prepare himself for. So what am I supposed to do as a student? Organize yourself. Time, title, target. So you people will have to organize yourself, familiarize yourself. You need not know the answers, but you should know where the answers are, how much of time it consumes, what exactly to refer to, and how one can help the other. Superimpose your knowledge, whether it is theoretical or clinical, onto your competitive exams or vice versa. Correlate all of these. Review periodically. This is most important. However well we read, there is a short-term memory. So revise, review completely so that it becomes a permanent memory in us. And ultimately, there has to be a common sense. This is what I can do. This is what I can achieve. Therefore, I should have a very clear judgment of my own performance. Now, in this scenario, what should you students do? The first thing is subscribe, because I am going to release a panel of questions into the community every other day. These questions will be analyzed, discussed, or even referred to by you people, and you can arrive at an answer. There is no time frame or anything whatsoever. You can copy, you can discuss, you can call over the phone, do whatever you want and come to an answer. The next day, I shall be discussing the answers as such so that there is some kind of a reasoning towards it. This I would like you people to kindly follow. So the first dictum is subscribe. 2, commit. Third one, follow up. These will be important. Many a student is just anxious to have a list of MCQs. Please see this one. MCQs without books are like boats without water. Absolutely useless. It's a waste. The idea of my classes will be giving you the questions and make the student go to the book. I am not a walking library. I cannot be a replacement for a book, but then I will be successful in taking my student to the book. Always we think of this crash courses and crash training. These things you people can have your own modus and approach it as you go towards the end of it. But then initially we shall try this particular method. And for your kind benefit, dear students, a ship in a port is safe, but that is not what the ships are meant for. So you people will have to take the plunge. Do not have any iota of fear. Then go ahead. I would like you people to kindly encourage me with your feedbacks. Thank you.